And we're back. Kia, I understand that moms who participate in the centering program are less likely to have a premature baby and to have higher breastfeeding rates. What are some of the other benefits of the program that you'd like to mention?
So we like to think that aspects of centering evoke advocacy and body awareness. And so some of the things that we coincidentally noticed at my last practice was women who participated in centering had also lower C-section rates. And that's because they were more aware of their bodies, able to advocate for themselves, and knew when to present for care because they knew when they were in labor. As well as breastfeeding adherence, meaning they tend to breastfeed for longer as well. The recommendation from Academy of Physicians, American Academy of Physicians, is to solely breastfeed at least for a year and a half, and we see that moms are breastfeeding at least for 8 months or to a year.
I agree with that because breastfeeding, I'm not gonna lie, I'm not breastfeeding, currently not breastfeeding, and it's because of the experience that I had, but personally, they made me want to breastfeed. Like, I was like, I'm going to breastfeed because like, it was like, we talked, like we did like the car seat practice, but it was like mostly like, you know what I'm saying, how to influence women to breastfeed, you know, how to give your baby, you know, knowledge from breastfeeding, and it's really helpful, you know, it's healthy for them, it's more healthier. And I get it, I know that I've been seeing like a lot of women, you know, breastfeed, and you know, I've been seeing the outcome of that. My baby is a good baby off of the milk, but everybody don't have the same experience. So, but like I said, Mercy centering really like influenced people to breastfeed, and it did stop people from having like C-sections. I'm not sure about everybody, but I know me. Like I had my baby at 36 weeks, which was a little bit early. I almost had her at 34 because I was so active, but I was 2 centimeters dilated, but they made me go on bed rest, and then I ended up having her at 36 weeks. But I still didn't need a C-section. She came out perfectly fine. Everything went well. I came to the hospital on time. I already knew about Braxton Hicks, so I was on it. I was like, I'm not on. If I'm feeling a little bit of pain, I'm gonna count the time, and you know, I'm gonna like, I was a little bit prepared. I was still scared, but I was prepared. So I was counting my time and stuff like that. So I actually came to the hospital and was able to get my procedure done for my baby because I was like, it was actually that time.
Is she your first?
Yes, my first.
Do you think
Our first. Me and her dad's first.
Well, do you think that with your experience with the centering program that if you were to have another baby, this is something you'd want to do again, or tell your friends, for example, if they were, you know, planning to become new moms, that this is something they'd want to do?
Well, it was actually people that was in there that had kids. So, you know, they must have really liked it enough to keep coming and, you know, showing up to it because, like I said, it was helpful not only just for the one you was having, but maybe the kids, you know, that you probably already had, you know, because it was telling us about like postpartum and depression and stuff like that. And I feel like that was more helpful, you know, well, it was helpful for me because I knew the weeks that she would be probably giving us postpartum on. You know, I had an upcoming from that. And I know a lot of people with other kids probably had it a little bit worse. So it was really helpful for them to be able to get space and come out to the center and then, you know what I'm saying, like get knowledge and go back and work with their kids, both of them.
Now, the Mercy Centering Program, I understand, finds its roots in the work of the Centering Healthcare Institute, which started in 2001, where they describe centering as a model of group healthcare with 3 components: healthcare, interactive learning, and community building. So is this kind of really just another way of saying it takes a village when it comes to having a child?
Correct. We like to think of it as a sister circle. And so women who are due around the same time kind of build a rapport with one another. There are a lot of women who journey through pregnancy alone. And so the centering helps the community build and kind of forces you to have a community of people experiencing like experiences.
Now, Kia, I've noted you've done some international outreach. You provided some care to low-income families in Guatemala, and you shadowed a labor and delivery unit at the new Ashanglin Community Hospital in Ghana.
Correct.
Well, what was that like?
So it was interesting. It was very interesting. I felt more connected, if I'm being truly honest. The reason being is because the birthing women, both in Guatemala and Ghana, tend to birth naturally, unlike here. So the Western world experiences epidural or pain management, which is completely fine and normal. However, both of those experiences made me more connected to the laboring process. in the woman as well, because we were going through the journey together in regards to active labor and the moans and groans of active labor, and then the beautiful delivery that happened afterwards. And so it was a great experience that I plan to do again.
Now, I understand you had some experience at the Walter Reed Army Institute of
Correct.
Research.
Mm-hmm.
And in some studies that involved anti-malarial drugs.
Correct.
We hear a lot about malaria nowadays. What did you learn from that experience?
Yeah, and so one of the drugs that we were working on researching and developing was such to kind of like break the cycle of transmission for malaria. And so it was a project that I was on for 2 years. I am unsure of completed development since I have left. However, the people at Walter Reed are very adamant and very motivated to kind of find a cure for malaria.
We'll take one more break and we'll be back to the last segment of Medoscopy.
With our patient population, they come from long distances sometimes, and they don't have all of the convenience of being able to come directly without catching 1 or 2 buses or other transportation. By them being in this facility, it's like a one-stop deal. And I think that's very important to the patient.
This center is sort of the culmination of the recommitment of Mercy to the citizens of Baltimore City. To have ancillary services right here on site so that the coordination of care can be managed as closely as possible.
When I think about our mission and our values and the values of excellence, dignity, justice, stewardship, prayer, they're lived in this group every single day.
We, the staff of Metropolitan OB/GYN, promise to provide a healing experience in an environment that supports the well-being of every patient.
This really represents our best chance to make a major contribution to improving the health of our Baltimore community.
So Jnai, do you feel that going through the centering program has made you prepared for this little one here?
Yes. I mean, you never can be really prepared, but because new stuff come every day. But I feel like they helped me prepare for it a lot, more than I probably would have been if I didn't go there. So I did, like I said, I did learn. It prepared me mostly for my pregnancy, and I was not prepared for that. Throughout when I was pregnant, it prepared me for actually having my baby too. I knew about what I had. I knew I was getting shots. I had to get the rogue shots and stuff, the Rh negative, because my blood was different from my baby's, and I knew all of that from centering. I was able to cope with that and know that I was going to be okay, know that my baby was going to be okay, know when I needed my shots. It was like I said, it was really helpful with me having her. And some of the stuff, like I said, when I told you about the depression and the postpartum, she told us that before the babies came. I did have a little bit of postpartum and depression, but I overcame that within 2-3 days, because I knew that I knew what was coming. I knew what would help me, overcome that.
So Kia, we've heard a lot about the Centering Pregnancy Program, what it's doing now. What's in the future, do you think?
So in the future, my hope is to bring more people in for more social support. And so we plan to expand that role. We plan to provide more need. We're looking into potentially doulas, and so having doulas be a part of labor support. We're looking into dipping into more educational curriculum as well, and more support in regards to through social work. If there's need for housing, if there's need for employment, that would be further down the road, but it's in my head as an outcome, a long-term outcome.
And what's been the process in terms of getting information out to the doctors about the program so that they know it's available and accessible to patients?
Mm-hmm. So our practice is in very close communication with one another. Every month we kind of discuss with the doctors as well as the additional midwives the updates in regards to centering and how many people that are going through the program now and additional needs. And so our practice, Metropolitan OB/GYN, is actually doing a really, really good job of recruiting additional people at centering because the whole practice is aware of the program.
Anything you'd like to add?
The people that she brought into the environment was like amazing. Like they was careful. Like they actually explained and broke down every piece of evidence they was showing and showing us, like the car seat, for instance. When the lady that came and did the car seat for us, showed us how to do. She like showed us every little part, every position to put it in. So that was helpful. The breastfeeding, they gave us stuff for like the future things like nipple out, like breast was like be real numb and stuff. They gave us like the pads and like they always give us stuff, for our body to make sure we're taking care of that as we go.
Jnai made a great point in regards to something else we hope to add, and that's a mother's closet. And so a mother's closet is essentially additional supplies to prepare women for the postpartum process as well as newborn. One of the things that we were able to give so far in the centering process is postpartum supplies, and so that include nipple shields, which is what she's discussing, as well as lanolin, as well as we were able to give diapers,
Yes.
as well as newborn baby clothes. And so we hope to expand that more. One of the things that I would like to add is we are doing our best to try to change the tide in Baltimore as regards to the poor maternal and infant mortality outcomes. And so centering is just a way to kind of create the nudge to shift the tides.
Yeah. And I was saying that you never know what's really going on at home for nobody, especially pregnant women. Like being pregnant in general is like kind of, it's when you're not ready or prepared for it, it can kind of be depressing. Just in general, even if you are having a good pregnancy, just the thought of having a baby now, you're not by yourself now, you're actually creating a whole nother human being. You go through a lot of different emotions being pregnant, and being in centering really helps you like deal with your emotions, calm them down, and understand your emotions. I learned that you cannot get paralyzed from from an epidural.
So there's a low risk.
Yeah,
yes.
low risk of that. Well, low risk of not getting paralyzed from epidural. And I actually did good with my epidural. I did great. So from centering to it was helpful with that. But like I said, overall, centering was like amazing. It was amazing. Like
Well, Kia, Jnai, and
royalty.
thank all three of you for being guests today on Medoscopy. So hopefully our viewers enjoyed the opportunity to learn more about you, the centering program, and some information that maybe can be helpful to them in their daily lives. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we meet again, may the road rise up to meet you.